So we'll try to read through this question together, okay, to find out what is happening with that person and what was done till now and all. Okay. So as soon as you get the question, the first thing that you have to do is to find out whom are you writing this letter to. First of all, so where should you go for that? I think you should go for the last part of your case notes. Okay, 1, 2, 3, 4, 5. This is the last part of your case note. Okay, so if you read this, using the information given in the case notes, write a referral letter to Miss Prabha, who works in Srishti Nursing Home Care Agency, Sydney, and you are requesting a home visit to provide instructions on self-monitoring of blood glucose levels and administering insulin injections following Ms. Ramamurthy's discharge. So, from this, you can understand that you are writing this particular letter for um, requesting or to request a home visit. Okay, this is important for you to know. Okay, it's a home visit. Secondly, you and why do you need this home visit? You need this home visit to provide instructions on self monitoring of blood glucose levels. Okay, what do you mean by self monitoring? Yeah, so the person has to do it by herself, all right, and she has to monitor the blood glucose levels, and then she has to administer insulin injections. She also needs instructions on how to administer insulin injections, how to take insulin injections by herself. Okay, so you are writing to someone who can go to their home and teach Anitha Ramamurthy about these two things. Is it clear? All right. So following Ms. Ramamurthy's discharge. So once you get this idea that you're writing this letter to request these two things, it will be easy for you to understand what is important and what is not important for the person, for the reader. Okay, for the letter, for the reader. Okay, so now we'll go back to the starting. Okay, so we know that Ms. Anitha Ramamurthy is a 59-year-old woman, and she is a patient in the inpatient department of a hospital in which you are working as a charge nurse. Okay, so you know whom you are. Okay, and how old is the patient? Patient is 59-year-old, and Anitha Ramamurthy is the name of the patient. Okay, and then her marital status, some social aspects and other aspects are written here. Okay, her marital status: she is married, height is 5'4", weight is 87 kg, BMI, she is 33, and she is a little bit obese. Okay, then address for correspondence means like how can she be contacted, because this is a home visit, so this may be a useful information. Okay, but we'll wait. Okay, admitted on this date, discharged on this date. Okay, and what was the diagnosis? She was diagnosed with acute appendicitis with appendicular lump. Okay, so this is her primary problem, but we are not writing anything related to this, right? We are writing for diabetic management, I guess, right? So automatically now you have to think, how is this thing connected to the diabetic management, and why are we writing for diabetic management? So there is a possibility that this disease has already been rectified, or there is a possibility that something related to this happened to that patient. So we have, let's read the case notes and find out what exactly is happening there. Okay, so treatment: she was conservatively managed, okay, with IV antibiotics, and she has been planned to undergo an interval appendectomy in 6 weeks. All right, so what is happening here is that her symptoms are managed, but her treatment, that means conservative management means like we are just treating the symptoms and we are not treating the disease exactly. Okay, if she has any headache due to that problem, we are treating the headache. All right, only the symptoms. So that is what you mean by conservative management, and some IV antibiotics were provided to her to carry out this activity. Okay, then an interval appendectomy has been scheduled for that patient to happen in 6 weeks. Okay, so it's pending. Now we have some social background. She's a businesswoman. She has a hectic lifestyle. She travels a lot due to work, lives with her husband, Mr. Krishnan Ramamurthy. She has two daughters, both are married. Elder daughter stays in Sydney. Um, she's about 3 hours away from her mother. She works as an entrepreneur. Younger daughter is in Canada, works as a dentist. Husband is the primary caregiver. Okay, who's the person who's going to be with the patient while she is discharged? Her husband is going to be there. Okay, elder daughter visits her husband once a year, scared of hospitalization. Who is scared? Anitha Ramamurthy is scared about hospitalization. Okay, prone to anxiety related to this. She is constantly anxious due to this. Okay, then she is fond of eating out. That means she has a habit of going out and having her food. She rarely cooks at home. That means she is not someone who cooks at home. So something related to her diabetes. Okay, let's see. Sedentary lifestyle. She is not active. She lives a sedentary lifestyle. Complaints of no time to exercise due to work. Does not drink or smoke. She is not a smoker. She is not a drinker. Okay. So we have some information about her diet as well. She has whole milk, ice cream shakes, fruit drinks, donuts, pancake, waffles, pizza, cheeseburgers, biscuits, muffin, cajun fries, hash brown, lot of fast food and sugary drinks is what she mainly consumes, right? Then we know, then we have some medical background about the patient. She is having, she is a known case of essential hypertension since 2014, and she also has diabetes mellitus type 2 since 2010, and she is not compliant with the diabetic medications. That means what? She is not taking her medications on time. Okay, I mean she has poor compliance to her medication. Maybe an important information because we are talking about diabetes as a part of request, and we know that she is poorly compliant with her medication. So maybe something that we might have to include in our letter. All right. So what we do is like we'll simply mark it. If you have a pen, we'll simply make a note of this. Okay. Then if we continue, admission diagnosis, that means when she presented to our hospital, what was the diagnosis that she had? Okay, she complained of pain in abdomen, right iliac fossa since the date. Pain was sudden in onset, acute in nature, non-radiating fever. So what all you see here is all about the symptoms of appendicitis, right? Related to appendicitis, nothing related to diabetes and things. So we'll simply read this, but we know that this is not something we have to include. All right, we don't want to include this thing. Then physical examination, her bp, temperature, and you have this vital signs we noted and all those things, but most of the information is no. Means what? She doesn't have any problem. See, no, 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 all these things. So this indicates that she doesn't have much problem with her vitals, and this is also not a very good information to be included in the letter. Okay. Then nursing management and progress. What was done to her as a part of nursing? All right. So on 18th, when she came, an abdominal CT was performed. Acute appendicitis was diagnosed, and all those things. Seal perforation cannot be ruled out. Total leukocyte TLC is mentioned. Then IV fluid was provided. Broad spectrum antibiotics were prescribed. Supportive treatment, regular blood sugar monitoring was done, and all those things was done on 18th. Okay, we don't think this has to be included, right? We'll put a cross to this. We'll go further. 19th, anything related to diabetes happened on this day? Can you quickly read through and say no? I don't think. Yeah, all related to her, uh, everything related to her appendicitis. Okay, 20 also the same thing, somewhat insomnia. She has headache. She has tenderness. Do you think these informations are needed for the nurse who is going to teach her how to take insulin? No need. Obviously, yes. So we'll put this thing also on. Then on 21, we are already checking for anything that is relevant. Okay. So Complaint of weakness. Okay, what is this? Review. REV means review. So there was on 21st, she was reviewed by a dietitian regarding, RE means regarding diabetic diet. So she was reviewed by a dietitian for a diabetic diet. Okay, that means it's common. It's very common to find REV as review. Okay, but you can understand it's review by a dietitian regarding diabetic diet. That means a dietitian came and talked to her to change the diet, because we know what kind of diet she is having, all sugary drinks. And so the doctor came. It's normal, right? When they come to the hospital, they will suggest that you have to change your food. So that happened with this lady. Okay, then on 22nd, something, nothing, she can ambulate slowly. She is independent with ADLs, activities of daily living, she can perform by herself. Okay. Then on 23rd, what is the situation of the patient? Patient is stable, accepting orally well, she is eating properly, adequate urine output, TLC showing improvement. Okay. Patient stable altogether, no much danger with the patient. Then another review happened. What is this? Endocrinologist. Who's an endocrinologist? A person who talks about diabetes, right? So endocrinologist reviewed this patient and suggested regular chart BSL. BSL means blood sugar level. So regularly this BSL has to be charted. Charted means monitored. Okay. Also, human mixed chart injection was prescribed subcutaneously. Okay. 12 hourly, 8 units. Okay. After a breakfast, 6 units after dinner. So what happened is, uh, endocrinologist reviewed and started on two things. One is, he suggested to chart the blood glucose level properly, and also the person started on was started on insulin injections. Okay, so I think this is also something. This information is important for us. We'll put a tick here. Dietitian information is also somewhat important. We will put a tick here. Okay, but rest of the information we'll put across. These are not something that is needed. An assessment was done. Patient stable with pain for interval, with plan for interval appendectomy in 6 weeks. So patient is altogether stable, and she has been planned to perform 6 weeks. Medications she is taking, Tabdolo and all those medications have been taken. Okay, okay. So these kind of, a list of medications, but even that is not important, because we don't have anything to do with the medication compliance or anything. So we will keep this also a big cross. All right. Interval appendectomy is something that we have to tell somewhere, because she has been scheduled for that. Okay. Now, if we go ahead, discharge plan is included. The person has to avoid strenuous activities. That means she should not do anything which is putting strain on her, because what will happen? That appendicitis may rupture. Okay, if it happens, it will be a big problem. So, and she has been advised to lose weight. Exercise program to start after appendectomy. Okay, that means exercise program has, if they are planned to start it after appendectomy. Normal diabetic diet and low fat diet. Patient requests more information, especially simple recipes that can be prepared at home. So the patient is requesting simple recipes, because the dietitian told that you have to follow a diabetic diet. The patient is asking, okay, tell me some diabetic diet which can be prepared at home, because she is fond of eating out. We know that she wants to now change that habit and wants to prepare something at home and try to want to have it. Okay, so she is requesting this information to a dietitian. But again, to the nurse that we are requesting, we don't need this information, right? Right? Because it is something that the dietitian has to do, but we are not writing to a dietitian. Okay. Then monitoring of fasting blood sugar, present chart during follow-up consultation. Okay, so she has a follow-up consultation on 30th. Okay, in the OPD department, and that is necessary. And this, it is necessary because she has to present the chart during the follow-up consultation. That means after regularly monitoring, She has to bring that chart and show it. All right. Then another information: husband has advised to contact us immediately in case of persistent high-grade fever. You know why? If it is, if the appendicitis breaks or ruptures, she may have a high-grade fever. So because of that, the husband has been advised that if at all she experiences, so nothing to do with our problem. Okay, our problem is what? Diabetes, means blood sugar, how to monitor blood sugar and all. This is something that the husband has to do, but you don't have to tell this to the nurse. So we'll put a cross mark here. Patient concerned regarding monitoring of blood glucose levels and insulin injections. Husband request home visit for demonstration. We'll put a tick here directly because this information has to be told. Why are we telling someone to go and give them that advice? Is because they are not confident about doing this by themselves, and they need someone to go and assist them or provide necessary information about how to do this properly. Okay, so we have to tell this information, obviously, right? So if you look at this case notes, we'll understand that from the starting, we have we have selected certain information. This is, obesity is what? A secondary information. Okay, secondary information we will put like this. Okay, that means it's important, not important, we will keep it because not nothing to do with the diet and all those things. So if we need, we may include. Okay, that acute appendicitis and appendicular lump we have to tell because she has been advised for an interval appendectomy in 6 weeks, so we have to mention that information. Then she was, this also I think is an important information. What do you think? That she was, when we are talking about appendicitis, we have to tell that she has been managed conservatively and she is planned for interval appendectomy. That's so. What about businesswoman and all those things? I don't think it's needed. Do you think that nurse has to know that she is a businesswoman? Any other information from this that you think? Again, do you think she has to advise on how to change it or what? Sedentary lifestyle is a problem that the nurse has to make something on that? No. She just has to provide instructions on self monitoring. So what is the important factor that she is that she another information is important. Diabetes mellitus, non compliant. This is important, this information, right? Right? This thing is also, I don't think is very important, right? You understood? So select what is important, what not too important. So now we are going to think, how are we? So now try to organize this thing in your head, okay? What are you going to say first about the patient? You will say that this patient is a diabetic patient who came to our hospital for this problem and she was conservatively managed. And after the conservative management, she has been advised to have this 6 weeks appendectomy. Okay. During that time, during hospital, a dietitian came and suggested her to change the food. Plus, an endocrinologist came and suggested her to change her to chart her blood glucose levels and to administer insulin injections. And she is not confident to do that by herself. So that is why I am requesting you to go and provide this instruction. This is the theme of the story, right? Right? So now this is exactly what you have to write in your letter. Is it simple as that? Okay. So now let's look at how we write. Okay. So I have already written a purpose here. So we start by the sample answer, in which the starting should be the date on the top left hand corner. All right. So you start by selecting the date on the top left hand corner of the letter. Okay. See what is the date here. So if you look at this, we know that it is discharge date 23/6/2017. So that is the date I think we have written here. Okay. 23/6/2017. Okay. Then Miss Prabha Srishti Nursing Home. This is something that you have to take from here. See, Prabha Srishti Nursing Home Care Agency. Address of the receiver. Okay. Then you have this thing regarding RE. Miss Anitha Ramamurthy, aged 59, and her age is mentioned. Okay, so this is actually called as the subject line. This is actually called as the subject line. This is the place where the person or the nurse will read and understand that this letter is about this patient. And how old is she? She is 59 years old. All right. Then a general salutation, dear Miss Prabha. Did you get this point? All right, dear Miss Prabha. All right. So now we are going to the next stage of it. Okay. So the next thing that you have to write is what? Purpose paragraph. Now you have to make the purpose clear in the initial part. Okay. So I have three different ways to write it. Okay. And the content is almost the same. Okay. If you look at this, the things that we have written in each of the paragraph is same, but it is entirely up to you. You want how you want to start it. It's totally your discretion. If you want to change the words, no problem, but the content should remain the same. Okay. See, the purpose of the first paragraph, the purpose of the letter, or this is to request, or this is to refer, anything is fine. Okay. Home visits. So the purpose of this letter is to request home visits for Mr. Ramamurthy, a diabetic patient who needs education on self-monitoring her blood glucose. So we have introduced this patient as a diabetic patient. Okay, because appendicitis and all those factors we can write in the body paragraph, but she should know that she is diabetic. All right, who needs education on self-monitoring her blood glucose levels and administering insulin injections. So the main point we have communicated early in the document as the marking criteria is suggesting. She has had type 2 diabetes since 2010 and has poor adherence to its management. Right? So we are saying that she has had means she started having this problem in 2010 and she still has it. That is what you mean by has had. Okay. So has had type 2 diabetes and so check out the next one. This is to request home visits for Ms. Ramamurthy who needs education on steps to monitor glucose levels by herself. Instead of writing education on self-monitoring, we just change the word steps to monitor glucose levels by herself. No difference. Okay. And administering of insulin injections. All right. She has been suffering from type 2 diabetes since 2010, which has been poorly managed since. Content remains the same. Just try to understand the difference in the language and try to modify it according to your personal convenience. If you want to change, if you have a better way to write it, try it, no problem. You understand what I'm trying to tell you? But the content or the matter should remain the same, because you don't have a choice here. You cannot write anything other than what we are specifically requesting with this case. Okay, we read the third one. This is to refer Ms. Ramamurthy, who is a type 2 diabetic patient since 2010 and needs home visits for education on self-monitoring her blood glucose level and administering insulin injections. Her high diabetes has been poorly managed. You understood this structure? Did you get this point? Right? Okay, after this first purpose paragraph, we can go to the next one, in which we can start with the normal settings. Okay, see, if you read this, this is the entire letter that we have. So after the purpose paragraph, see, so the purpose of this letter is to request home visit for Ms. Ramamurthy, a diabetic patient. So this is your purpose paragraph. This is your purpose paragraph. Okay, and after that you have started in a chronological order. Okay, with the same way that we planned. She presented to us on this day and was diagnosed with acute appendicitis. During hospitalization, the adopted treatment plan included conservative management and plan for interval appendectomy 6 weeks later. Her recovery has been encouraging or promising, whichever you want to write. Okay, so far that means she is making a good progress and she is being discharged back home today. All right, so this is an information about her present situation, right? So she is in this condition now. Okay. Now, she has been educated regarding the role of nutrition in effectively controlling her diabetes by a dietitian. We are talking about the review that the dietitian did, right? So she has been educated regarding the role of nutrition in effectively controlling the diabetes by a dietitian. Moreover, this is a controversial word. Okay, I would recommend that you don't use this moreover. Instead, you can put a full stop chart. The hospital endocrinologist has advised her to chart blood glucose daily and control her sugar levels with insulin injections until her follow-up visit scheduled on this day. Then the factor, she is accepting of this but feels that she is not skilled at doing these herself. That means she knows she wants to do this, but she thinks that she's not able to do this by herself. That is why you are requesting this person to go home and teach them, right? So, as a consequence to that, consequently, because of this, she is accepting and she feels that she is not skilled. Consequently, at her husband's request, I am requesting you to visit her at home and provide necessary guidance so that she can competently perform these procedures. You understood? Right? Very simple way of organizing information. So when you looked at the case notes, you thought that it had a lot of information, but then finally when you wrote the letter, you understood that you don't have to include all the information. You have to omit as much as you can. All right? Unnecessary information has to be taken out, and only the necessary information has to be summarized and organized and presented. All right. See, I have written another one. Okay, the same thing, but a different letter. Means the same situation, but in different language. I am writing to request a home visit for Mr. Ramamurthy, a diabetic patient who needs education on self-monitoring her blood glucose levels and administering insulin injections. She presented to us on this date and was diagnosed with acute appendicitis. So here in the introduction itself, we told that she has recovered significantly and her appendectomy is scheduled for 6 weeks. She is being discharged today. Okay. She has been suffering from type 2 diabetes since 2010 and has poor adherence to its management. During hospitalization, she has been educated regarding the role of nutrition in effectively controlling her diabetes by the dietitian. Moreover, the hospital endocrinologist has advised her to chart the blood glucose daily and control her sugar levels with insulin injection. She has been asked to present her blood glucose chart during her follow-up visit scheduled on this date. She is willing to perform these procedures but lacks the confidence to do these independently. That means she is willing to do this but she thinks that she is not able to. Therefore, her husband has requested a home visit for demonstration of blood glucose monitoring and taking insulin injections at home. It would be greatly appreciated if you could visit her and provide the requisite instruction, that means the requested information, so that she can perform these procedures on her own.